A weird vibe out here.
Yeah, pediatric drowning will do that.
Glad I didn't end up in there.
Yeah, you and me both.
Any life-threatening pediatric case is difficult to handle emotionally for everyone involved, including both staffs and family members.
I'm off to North 2, dysuria.
Dysuria means burning micturition, a sign of urinary tract infection, which presents additionally with fever and flank pain.
What happened to 2 visitors a patient?
It's the fentanyl overdose. It's gonna be an honor walk. He's an organ donor.
An honor walk, also called a hero walk, is a ceremonial tribute given to a patient who is about to donate their organs, usually after being declared brain dead. Hospital staff, family, and sometimes the public line the hallways as the donor is wheeled from the ICU to the operating room. Everyone stands silently with heads bowed in honor of the donor, hence there is a crowd there.
Myrna? Myrna. Oh, no, not today.
She's gonna do the sternal rub to test response to painful stimulus in suspected unresponsiveness.
Myrna!
What the What do you think you're doing?
I was just checking on you, ma'am.
You can't even take a nap in this hellhole. Off.
Sorry.
She should have just called her by her name first, instead of starting with a painful stimulus. Sternal rub is pretty painful.
Hi, I'm Dr. McKay.
Piper. Laura.
And you guys are...
She's my boss.
Oh, what kind of work?
I'm an accountant and she's my assistant.
Cool. Piper, are you okay with your boss being here while we talk?
Yeah, I'm good.
Are you sure? I'm gonna be asking you some pretty personal questions.
She doesn't mind. We have no secrets.
What does that even mean?
Okay. So burning with urination, when did that start?
About 2 days ago.
Why don't we let Piper answer the questions?
I'm sorry. We've been waiting so long.
Usually an informant isn't needed in history taking of an adult, unless the adult isn't responsive, or if the case requires history from the informant.
About 2 days ago.
Any blood in the urine?
Blood in the urine or gross hematuria could be due to urinary tract infection, kidney stones, and even tumors.
I don't think so. No, she would have definitely noticed that.
Okay. I'm gonna get you a gown and I'll be right back. Okay?
Okay.
Any change with the extra dilaudid?
Not really. The pain is still there.
Acute abdomen with tenderness on palpation along with signs of guarding and rigidity could be a surgical emergency with peritonitis due to perforation.
Sorry, just to review, no fever, no vomiting, no diarrhea, no constipation.
Correct.
But peritonitis would have all these symptoms. Acute peritonitis usually presents with severe abdominal pain along with fever, nausea, vomiting, and changes in bowel habits like constipation or diarrhea. Fever would be expected at least if it was perforation causing peritonitis. Could this be something else?
When exactly did the pain start?
10:15 this morning, all of a sudden.
That's very strange.
I agree.
Will you tell me everything you did this morning?
Took a shower, had breakfast, some coffee, toast with jam, yard work, moved some firewood.
Did the pain start before or after the firewood?
A little bit after. I might have got a splinter in my foot. I wasn't wearing socks. Other one.
Looks like puncture wound there. How does this possibly explain the abdominal symptoms though?
2 small puncture wounds, 1 millimeter apart.
2 splinters.
Whoa.
What?
There's a dead black widow spider in your shoe.
You're shitting me.
Red hourglass marking.
Okay, so this is an interesting twist to the case. The black widow spider is venomous, and its bite can cause systemic neurotoxic effects. It has the characteristic red hourglass-shaped marking, often appearing as two triangles joined at their points on the underside of its abdomen, differentiating it from other spiders. Interestingly, this spider's venom can cause severe abdominal cramps, which can actually mimic peritonitis or acute abdomen due to abdominal wall rigidity. This could possibly explain her symptoms, and a CT scan may not be required in this case.
We need IV diazepam. Start with 5, might need 10.
The black widow spider venom contains alpha-latrotoxin, which causes massive release of catecholamines and also release of acetylcholine at neuromuscular junctions. This leads to excessive muscle contractions or spasms, causing muscle cramps, along with other autonomic symptoms like tachycardia, hypertension, sweating, headache, and restlessness. Hence, the main symptoms include severe muscle cramps in chest, back, and abdomen, causing a stiff board-like abdomen mimicking peritonitis. So, apart from wound care and pain control, benzodiazepines like diazepam are the mainstay of treatment, as these act as muscle relaxants to ease the muscular spasms and cramps. Antivenom is reserved for severe or refractory cases and is rarely needed.
What does a spider bite have to do with my Crohn's disease?
Oh, nothing.
Having Crohn's as past history rather complicated the diagnosis and made the doctors think of Crohn's complicating into perforation and peritonitis rather than thinking of other simpler differentials.
Black widow venom can cause muscle spasms in the belly. People have had surgery thinking it was appendicitis.
The black widow spider bite can mimic any cause of acute abdomen, including appendicitis. It could even cause symptoms mimicking tetanus, all of which can be tied to its venom's spasmodic effect.
Hi, Dolores. Why didn't you get her to CT yet?
I don't think she needs it.
Yeah, CT isn't required unless the surgeon would like to assess the progression of Crohn's disease too, in addition to the main diagnosis of spider bite. There is likely no perforation, and it ties to the fact that there is no fever and other GI symptoms.
The abdomen is rigid. She's perfed.
Maybe not.
What are you giving?
Diazepam.
I didn't order that.
I did. She has a rigid abdomen, but no other GI signs or symptoms. It didn't make any sense. There's a black widow spider and a bite mark on the foot. The venom is causing spasm of the abdominal wall musculature.
Whatever you guys gave me, it's working.
Possibly.
No, definitely. I'm much better.
The opioids given before doesn't relax the involuntary muscle spasm caused due to the venom, and hence the pain persists. However, benzodiazepines do cause relaxation of the rigid abdominal muscles and hence has relieved the pain here. Hence, knowing the exact cause of pain and countering it with appropriate medications is much more helpful than a bunch of pain meds given in general to ease pain of any and every sort.
Take a deep breath. Good, good. You from Pittsburgh?
2 hours north, like Mill Village.
Okay. You have any family you want to call?
I don't have a phone. She can use mine if she needs to.
Okay. Lay down. I've never heard of Mill Village.
Yeah, nobody has. Population 400.
Wow, that's small.
Tell me about it. After high school, I had to get out of there.
Well, you're lucky you found a job. Any pain around here?
A little.
Tenderness in the lower abdomen, I guess, could be due to cystitis or inflammation of the bladder relevant with the burning micturition here, or could be pelvic inflammatory disease or other uterine or ovarian causes.
Okay, sit up for me. You gave us a urine specimen?
Hours ago in the waiting room.
Okay. Well, I'll find the results and then you might need a pelvic exam.
Is that really necessary?
A pelvic exam includes external inspection of the vulva, per speculum examination of the vagina and cervix, and bimanual examination to assess uterus and ovaries and detect any tenderness. It could be useful here to detect cervical motion tenderness, which could be a sign of pelvic inflammatory disease, which means infection of the upper female reproductive tract, including uterus, fallopian tubes, ovaries, and cervix. It could be another differential if UTI isn't the case here.
It could be. If there's no bladder infection, it's important to check.
Okay.
And if we do a pelvic, Laura will have you step outside for a minute.
I prefer to stay with her for support.
That's weird.
Piper, do you want some privacy?
No, it's cool. She can stay.
That's even weirder. Why would you want another person to watch when a pelvic exam is done?
Okay. All right, I'll be back.